Hi everybody, I'm Ruth from Photizo and Liv is filming this. Hopefully it's just going to be me and Harper in the video. But just since I came to see you all at Paw Camp, there's been further progression from of the science behind the modality of what Photizo is, which is photobiomodulation. And last year I was really privileged to go to the annual scientific summit in London, the global community of photobiomodulation, and this isn't just for animals. So just to give you an idea of the range of applications that this red light therapy is actually being used for now. So there were talks over 3 days, really intense, on neuro rehabilitation, stem cells, regenerative medicine, acupuncture, metabolic and autoimmune disorders, reproductive health, antiviral, antimicrobial applications, aesthetic medicine, which has been around a long time, bone and musculoskeletal disorders, pain management and addiction, sports rehab, wound care, dermatology, ophthalmology, dentistry and oral care, and even a supportive care for cancer treatment, the painful side effects of cancer. So that gives you an idea of the range of applications that now we're using this modality for, as well as all the dose protocols that is given in our user guide. We're also trying to share the information about using it proactively for sports performance and rehab, and recovery after sports. And I think that some of you are still not quite sure how to apply it properly. Is that correct? So to be honest, there's no right and wrong. Don't overthink it. It's a point and shoot principle with Photizo. All the dose is programmed into it, and all you have to do is press a button and just apply it where you think you want. Often they will tell you where they want it. But for sports performance and recovery, there are some key stress points, muscle groups that you need to try and assist with all the flexibility, mobility, and or get all that blood flow and all the lymphatic system for clearing out the toxins that build up with intense sports. With Harper here, she has it everywhere, I hear. But say, for instance, you want to start on the hips, you place it on the body somewhere, wherever, press a button, and ideally you want to keep it in that same spot for the duration of the 31-second dose. If it's a large muscle group and you've got some guidance from us about the sports protocol, and if it's you need to do double dose, triple dose or whatever, then you can do it in the same spot. There are some dogs that are sensitive when it goes to a continuous pulsing in the latter half of the dose. So if your dog is sensitive, don't worry too much about not doing it in that one spot, because some people can actually move the lens over that muscle group and do multiple doses over the muscle group. But the sports protocol that we've got from a canine massage and gait analysis therapist, she's given you some great points on the large muscle groups and small muscle groups, and depending on the overall weight of your dog, it gives you a really good guidance on how many doses you can apply over each muscle group. And yeah, that's really the principle. You can hold it in the one spot for the duration of the dose, or you can just use it in a sort of slight massage type movement. Some people, if they're using it just for maintenance and proactively, when you start the dose, you can actually start at the top of the spine. I'll wait for the dose to finish, because they hold a lot of tension in the neck. So you can start it at the top of the spine, upper, start the dose, and gradually move it down the spine fairly slowly. And you can do that a couple of times. So the thing is, on the spine, there's a lot of acupoints, and there might be one point where they're quite sensitive and they might sort of flinch a little bit away. I think you mentioned, Ellen, that it sometimes happens. So yeah, there's no right and wrong, to be honest. And as long as you're doing it on a regular basis during, when you're having training sessions before and after, and certainly for build up for championships like this, a few days before, maybe adopting the maximum dose protocol for the size of your dog, or even the minimum, there's a cumulative effect. So you can just move it slowly. Yeah, and if you get release signs on one particular spot, like yawning, or just the eyes going once they've relaxed down a little bit, or they reposition themselves to where they might want it more, a few more doses on one spot, it won't do any harm. As I've said to Matt quite a few times, the worst that can happen is that nothing happens with this modality. There's really you can't do any damage. The only time we say just don't go overboard with the dose after dose after dose on the same spot is when you're tackling an open wound. That's the only time we say just one dose surrounding the wound area and over the wound area, one dose per spot. You can do that morning and night. I think the user guide mentions about once a day, but lots of people have said they've had brilliant results twice a day, morning and night, some even 3 times a day. And the same goes for yourselves as well. To see that our little diagram on the sports protocol will give you an idea of where the large muscle groups are, where the small muscle groups are. And our protocol, it's not set in stone, but it just gives you an idea on small difference of the dose protocol for muscle performance and recovery on each muscle group. So is there any questions from anybody? No. Right. Okay. Yeah, that's a good point. So what this does, these particular wavelengths, they are absorbed into the body and they fire up in the mitochondria. Is anyone familiar with the mitochondria? Yeah. So they're often described, mitochondria is the powerhouse of your cell and that's all cell types throughout the body. So it doesn't matter where you apply it, when your body is responding to some sort of trauma, the effects from this modality is the same. And as good as our nutrition and hydration and everything that we do for our canine athletes and us as athletes, as good as all that nutrition is, what the light does is it provides a spark in firing up the mitochondria to produce more cellular energy. And with athletes, we're asking the muscles to actually provide excess amount of energy compared to everyday life. And that's why in a sports protocol, you need to actually increase the dose compared to using it for, say, a muscle injury or a ligament problem or joint issues. So yeah, it's just a firing up of the mitochondria first and foremost is the key mechanism. There's also discussions about the fact that what it's doing is increasing your electrical potential for humans and animals. And I'm an advocate for that, because when I broke my foot and ankle about 18 months ago, when I first applied the light therapy on the injury, the sensation that I got was almost a tingling, as if my foot was attached to electrodes. It was like a pins and needles sensation. I don't know if any of you have used any sorts of TENS machines, but it was like an electrical signalling that was being fired up because the trauma was so bad. I don't know if you had any sensation like that when you used it after you were up.
I haven't had a tingling, but I felt like a warming and then like a sort of like energy going to that area. Yeah. It immediately felt more flexible.
So yeah, what it does is it with the cellular energy increase, it just helps the body control that initial acute inflammation. It moves on to the next stage of healing, and so on and so on. So you can use it from even pre-trauma, pre-elective surgery to prep the cells, and you can use it while the body is repairing, and you can use it while your body is creating collagen to repair and beyond. So if any of your dogs have got difficult, challenging sites where they've got old injury spots and they're continually niggling, what this also has shown to do is help to remobilize maybe old scar tissue. And there's a new paper that I've showed Matt that's just come out on police dogs, where it was 16 police dogs, healthy joints, and they had a full assessment on their range of movement of both elbows before applying a device, with this modality. They applied it to one elbow for 5 minutes and not the other one. And then after the assessment, it showed that the elbow that was treated had a significant improvement in the mobility of the elbow. And that's in a healthy animal. It's not necessarily an animal that's got some joint issues. So that just gives you the idea of what the slight improvement in that range of movement and flexibility of an animal athlete can make all the difference between winning and losing. So any other questions? So whenever there's specifically when a trauma has occurred, when there's swelling, we always recommend the application of it on lymphatic points. I think predominantly in a healthy athletic animal, you wouldn't need to necessarily do that. It's just about pre-treating exercise on the muscles and also after as part of the cool down. There's been some discussion about when to do it. Question is before or after, and I think the evidence has shown there's not really any significant difference between the two. If you want to get the best of both worlds, I would say do it. If you've got the time, do it before and after.
Just following the sports protocol.
It's following the sports protocol is just a guideline, to be fair. But all I would say is if you're doing it on a regular basis, think of it like taking supplements. You wouldn't take a joint supplement once in a blue moon. You'd take it on a regular basis. And the same principle is with a device like Photizo, to get that spark of energy into the body, help the cells do what they're supposed to do. And it's the blood flow, the lymphatic system improvement that kicks in. All that signalling, if there's any slight muscle tears, with all the exercise that they have to do, it'll help with all that repair process and help maintain their flexibility. Overusing it, yeah. The only time we have the science has shown that possibly overuse can maybe reduce the effect of the healing is in a wound situation, but that predominantly, to be fair, is in cell cultures. It's not necessarily a study that's been done on living animals or living people. But to be fair, with wounds, what you're trying to do is encourage the healing from the wound bed upwards. You don't want a wound to close over the top without the wound bed having closed. So, say if you've had surgery, it's a very good idea to just apply doses literally around the wound margin and encourage all that goodness of the oxygen and nutrients and the surrounding tissue. That's the only time we say just stick to one dose per spot and maybe only 1 or 2 sessions a day.
You can't
overdo it.
Many doses and you'll burn them. Like there is the worst thing that will happen is nothing. There's on the studies that we've seen, there's you know, another dose makes it better, another dose makes it better, another dose makes it better. Then you hit this flat line where the more doses, just nothing happens.
Yeah, the pain relief effects, the dose guidelines are a lot higher than when you are aiming for a healing effect. And Matt's right, there's this kind of curve, and when the healing effect drops off, what happens is it goes into what's called an inhibitory effect, but that is inhibiting pain. So the pain dose is higher than what you need for a healing effect. So, but yeah, when you're asking the body to perform excessively to normal everyday life, which is what happens with these animal athletes, then yeah, as long as you stick to really a dose protocol that we've taken from evidence on human athletes, then I don't think you can go wrong, to be honest. Yeah. Yeah.
Is it a power up? Is it like?
It is actually, yeah. So when the software was being designed for Photizo back in the early noughties, 2001, I think they started working on it. So there's lots of evidence with this modality about using pulsed light for helping, I suppose, the effects through different tissue types in the body. And also, I don't know if you're familiar with the idea of the body gets used to something, you know, certainly in electrotherapy, the body can get used to the intensity, and then you have to ramp it up to actually get, yeah. So, but with the idea of using the pulsing in the third part of the dose, yes, you're right, it goes through a sequence of pulsed light, high frequency, so it doesn't interfere with any concern on, you know, epilepsy or you know, fitting or anything like that. But all that does is that it helps with the absorption through different tissue types, and then it ramps up after, on this model, after 10 seconds it ramps up to continuous light, and that's when you see the brightness change. So that at that point, if you're using it anywhere, certainly down the spine, and you hit an acupoint, on some dogs they can be quite sensitive to that. Yeah. If you get like a reaction as if it's, oh yeah, just lift it away, just stop. Yeah. And there are specific devices purely for applying over the acupoints if you know where they are, and then sometimes you just bathe it, because the acupoint doesn't need strong intense light. The pulsing is in there for a good reason, and you're right. The thing is, we do advertise, we're fully transparent on the spec of it, but it does power up quite significantly at that point. And yeah, there's benefits obviously when there's pain and tension, when it goes to the intense continuous light, but equally, you know, it's great to have that option of pulsing in there for sensitive points. I mean, the thing is, we're having wildlife centres, zoos, and you know, tiny little voles and mice now bats being bathed in this, and you know, with that, it's hands off. You know, they really try and minimise the handling, so they are literally just bathing them in the light, as opposed to using it on elephants. Yes, it is being used on elephants. Not saying your dogs need an elephant dose, but yeah, it's just knowing your dog at the end of the day. You know where their difficult points are and where they might have a bit of a weak spot, and yeah, just the challenging areas of their body. So and often they know, just be guided by them, you know. And if they don't want it that day, don't force it, because we're all for consent-based treatment. They have to be totally on board, relaxed, to be able to receive this energy. You know, all it is energy.
Right from like the fascia, the skin fascia, all the way down.
It will do, yeah. I mean, in one single session, we can't, there's always discussion about how deep the light penetrates. You won't be able to necessarily see in here, but, you know, it penetrates through a hand. The near infrared wavelength, because there's two wavelengths in here, near infrared goes that bit deeper into the body, but don't be too hung up about how deep the physical light penetrates, because the thing is, when you're doing it little and often, as I say, there is this cumulative effect throughout the cells, because the cells talk to each other. And even though we can't make claims about any real deep internal pain, we have had great feedback, and personally I can say it works on UTI pain, it works on IBD pain, but you have to have a bit of common sense and use it more excessively than if you were just doing a superficial muscle, for instance. The fascia is quite interesting actually, because there's more evidence coming about the myofascial release approach, and you know, there's the lack of hydration in the fascia, but one of the effects that is shown with the application of this red light is how it interacts with the water in our cells, and it helps the structuring of the water. So yeah, hydration is big, but it will potentially help with you know, and I think also the fascia is very important for that deeper connectivity into the deeper tissues. So yeah, just even if it's superficial penetration of the light, then with using it on a regular basis, you know, the effects do go deeper, especially if you've got a dog you know, with our own little cocker spaniel. Before we realised she'd got IBD, she's only quite young, and she was having a massive acute attack of IBD pain in the middle of the night, and we just literally repeated doses on her abdomen. And I'll tell you what, if we didn't have the Photizo there, I don't know what we would have done, but literally, you know, she was shaking, you could see she was in pain. We used it for 20 minutes on her abdomen. It helped she gradually stop being sick. But whenever we see the slight sign that something has upset her, straight on the abdomen. But yeah, you do need to apply more doses when you've got deeper acute pain. And also what I was going to say as well is, remember that sometimes sites of pain, it can be travelling from elsewhere. So their paws are quite sensitive. Don't forget, use it on their paws as well as their shoulders and down the spine. But yeah, the sports protocol will give you a bit of a diagram on the main. Yeah, I've got a handout. Yeah, that will give you a good guide really on the muscle groups that you need to be perhaps focusing on. But yeah, just you know, have a bit of intuition, and don't overthink it, and be guided by them. And it doesn't matter if you just want to use it to have just really lovely bonding time and wellness time. Yeah, and just another, you know, obviously it depends on how much time you've got, but yeah. I mean, our old spaniel, he had cups. He had this gum disease, so we used it on his jowls. You've probably seen on some of our graphics, we taught him the rest command. He had his chin, and you know, through the jowls, because he had that condition where his gums got all ulcerated. So jowls, eyes, ears, but yeah, so nowhere you can't use it really.
Thank you very much.
Thank you.
Thank you.